Afternoon or good morning, everyone. My name is Chris Heckert, and I'm the Senior Director of Labeling Solutions and Network Partners. Welcome and thank you for joining us for this Brunch and Learn on eIFU best practices. A few quick housekeeping items to address. First, we ask that you please mute yourself once you join. I have a colleague, Renee, who is actively patrolling the participant sections and will manually mute you as needed. So don't let Renee hear your dog barking. We ask that you address all of your questions via the chat feature. And lastly, this webinar is being recorded, and you will receive the recorded presentation, a PDF of the PowerPoint, as well as our network partners white paper on eIFUs. And so we begin. Today's webinar is about eIFUs, why you need them, and how to go about creating them as efficiently and safely as possible. We've been helping our clients reformat and post their eIFUs for the past couple of years and believe that we've perfected the recipe for making and posting eIFUs. Our process is the most efficient in terms of effort and one that uses the best technology to eliminate errors. There's also a bonus. Your eIFUs will look absolutely fabulous. Since we'll be sending you the notes from this webinar, feel free to sit back and enjoy the next 30 minutes as I share our secrets of successfully
walks around. He lives in that house over there.
Remember, you're going to get muted if we catch you. Okay, first off, I'll assume you know something about the need for eIFUs. Since we've only been sheltering in place for a month, you can't possibly be desperate enough to have joined a webinar on eIFUs for the social aspects. If you're that lonely, text me. I have an extra cat you can have. The EU MDR is very clear. EU MDR Annex 1, Chapter 3, Section 23.1, ... Instructions for use shall, if the manufacturer has a website, be made available and kept up to date on the website. The extent and the details of this requirement have some nuances. At the very least, you have to post your IFU to a website. It's more complicated if your device is an implant. You have to post your IFU to a website. You have to provide information to the patient, and you must provide that patient with an implant card. If your device meets the criteria found in e-labeling regulation 207/2012, you have the potential of providing the IFU electronically and removing the paper IFU. To meet the most basic requirement, you just need to post a PDF on a website. Post this PDF as is, or you can reformat to make it. You can post a copy of your folded up gas station roadmap style IFU to a website and meet the letter of the law. But your notified body may take a dim view of your upside. Since we don't have a lot of history with the notifying bodies decisions from MDR audits yet, that's a risk you'll assume if you take this approach. Evaluate that risk, and you may decide that some reformatting of the IFU is appropriate. There's also some basic requirements for the website. Any website containing instructions for use shall fulfill the requirements set out in points B, E, and G of paragraph 2 of Article 7 of Regulation EU number 207/2012. B, it shall be protected against hardware and software intrusion. E, it shall fulfill the requirements of Directive 95/46 EC, since superseded by General Data Protection Regulation, the GDPR. And G, all previous versions of the instruction for use issued in electronic form and their date of publication shall be available on the website. As I said, it's more complicated if you're making implants. The MDR Article 18 says, the manufacturer of the implantable device shall provide with the device the following: A, information allowing the identification of the device, including the device name, the serial number, lot number, the UDI, the device model, as well as the name, address, yada, yada, yada. You can read Article 18 by yourself. It's in the EU MDR. In an IFU, you need to provide patient information and you need to provide an implant. Instead of providing this patient information in all its glorious languages in a paper, is using the patient to a website with this information. Most of the industry is using a fairly generic pre-printed paperboard credit card sized card. Credit card sized card, which is adorned with the manufacturer's logo and the patient information website. At the time of package is labeled with something like a product label. This patient implant card label has the catalog number, the body side, other product specific information, as well as the lot or serial number. The product description is translated into the languages where the product is registered. It also has a write-in space for the date of implantation, the patient name, the surgeon name, and the hospital or healthcare center where the surgery was performed. We could talk about this for a couple of hours. We have clients that we have discussed patient implant cards for weeks, but because so few of you will need these, I'll ask that if you want more specifics about the patient implant cards, please see the guidance issued by the Medical Device Coordination Group, or as they're known, the MDCG, or as I refer to them, what a terrible name. But anyway, you'll see that in the notes from today's presentation. If you still have questions after that, please contact one of us at Network Partners and we can discuss your particulars separate from this webinar. Lastly, if your product meets the criteria of 207-2012, you may be able to remove the paper IFU from your package once the e-labeling requirements are met. For those of you unfamiliar with 207-2012, this is the regulation allowing for e-labeling in the EU. Beyond the 3 website requirements needed for the basic eIFU required by the MDR, there are a whole laundry list of website requirements for e-labeling, like a toll-free number so people can call to request a printed copy, that printed copy mailed to a user within the acceptable time, safety and backup systems, limited system downtime, and some more things to make sure that the information is available to those that need it. You must perform some risk management activities along these requirements and work with your notified body prior to any action. But this regulation could mean significant cost savings and a lot less paper sucking up ethylene oxide, getting shipped all over the world just to be thrown away. Again, if you have specific questions on this, review 207-2012 or check out our eIFU white paper and feel free to contact us. We've got to get to the fun part of this webinar. So we understand the need for eIFUs. Now we just have to execute putting our IFUs online. Like any project, you want to lay out a plan before you dive straight into making eIFUs. You may have a dozen IFUs, 100 IFUs, you may have 500 IFUs. We're working with a client that has 850 IFUs, but no matter how many IFUs you have, they are most likely inconsistent in the manner in which they're formatted. It might be the program that was used to format the IFU, the number of languages in your IFU, as well as just the format itself. You'd likely have a dumpster fire. And I sometimes tend to hyperbole when talking about IFUs to keep myself awake. Dealing with these messy inconsistencies is irritating for a normal person. Asking your sensitive, detail-oriented graphic artist to decide if changing an M dash to an N dash constitutes a change of content is tearing at their version of reality. If you haven't had one of these conversations, I'm happy for you. Without a standard to refer to, it is impossible to reach a happy conclusion in a discussion with a graphic artist because they are correct. An M dash is different than an N dash. So what we have found is that the best first step is to establish a style guide for your eIFUs. The style guide is where you choose the page size, the font type, the font size, the style on the header, the style on the footer, what to bold, how to bullet, how and when to indent, and on for all your IFUs. I suppose you could do this incorrectly, but you already have some IFUs. So pick the aspects that you like best from your favorite IFUs and write them down. Your biggest questions to answer are going to be, do you post your current IFU as is? Do you reformat your current multi-language IFU with larger font and page size that makes it printable? Or do you go all in with a country-specific single language IFU that could present itself automatically based on the country of where the person is accessing the website from? We found that by creating or revising your style guide, you can save a lot of time as you revise files that were originally written by different people using different styles over many years. We have found that bringing all files into the latest version of InDesign, becoming consistent with the number of languages the file is translated into, and having a format that allows your graphic designer to know if the section is indented, what a table's title should look like, and not have to stop and ask clarifying questions every 5 minutes, allows for the work to be done efficiently with a much more consistent end result. When it takes you 6 weeks to finalize your style guide, don't be exasperated. Really appreciate that by doing it once, you've saved yourself and your organization from having to do it on every single IFU. You're going to create new labeling, so you're going to need to use change control. Being able to attach your style guide to your change order will make getting your change orders approved easier. Depending on which type of eIFUs you're aiming at, you'll have a different number of steps in your process. If you're going all the way to 207-2012, you'll need to do your risk management exercise first. You'll have to document that you're not creating or increasing any potential risks. You should be able to show that e-labeling mitigates the risk of losing the paper IFU, but you'll have to address the issue of internet accessibility. You should also consider proceduralizing the eIFU creation uploading process. By putting these eIFUs online, you're committing to managing the revisions of these documents. You should get organizational agreement on how you're going to control that going forward. If you haven't recognized it yet, you will likely understand at this stage that your corporate website was not designed for eIFUs. Your website most likely does not have version control. You likely do not have objective evidence that your site is protected against hardware and software intrusion. And while you think the General Data Protection Regulation has something to do with privacy rights, you can't find anyone in your company that really knows what GDPR is. You should add shopping for an eIFU hosting website on your list of things to do, stat. At this point, your graphic artist has revised your initial test IFU. Whether he's just tidied up a multi-language IFU or completely reformatted a multi-language IFU into 24 separate single-language IFUs, you need to confirm that the only content adjustments were part of the change order. You can conduct a 1-over-1 visual review comparison of the original and the revision. But reformatting every IFU, every language, can so easily lead to an unintended change. Visually reviewing all those different languages in alphabets you only see when you look at multi-language IFUs is painstaking. It's difficult. It takes a long time. And the more you review, the less assured you are that you've caught all the errors, right? Have you ever tried to compare a paragraph of Arabic to another paragraph of Arabic, assuming you don't know Arabic? I can look at a paragraph of Arabic for 5 minutes, and the only conclusion I come to is that there are between 8 and 100 characters in the Arabic alphabet, and yet they all look the same. We've found that using a validated text verification tool is the fastest and surest way to confirm that we've maintained content integrity. We use the Schlafender Haza TVT. It allows us to compare the reformatted copy to the original. It will highlight the changes in format, which we expect, and it will highlight any change to content. It can produce an annotated copy of the changes, like you're seeing here, as well as a line-by-line report of deviations. When your deviations line up with your intended changes, which could be that you added an IFU document number to the header of each individual language, or you added the ISO country code or ISU language code to each language, you print out, sign your report, and attach it as objective evidence to your change notice and move on to the next file. The text verification tool takes literally seconds to compare 2 documents, and you have a finished report in minutes. And it doesn't get tired as it compares the Arabic alphabet and the Cyrillic alphabet and katakana and kanji and Greek and on and on. This text verification tool is a real game changer for text comparison. Now that you successfully created a reformatted PDF of your IFU, and it's time to put it on a website that meets the requirements of paragraph 2 of Article 7, which means version control, it's protected, and GDPR compliant, We here at Network Partners find that the CARAD website, it's CARAD, you've seen it, it's QARAD website to be a nice fit for the majority of our clients. As the site was initially created to meet the e-labeling requirements of 207-2012, it easily meets the lesser requirements of the EU MDR. So we see clients that have a mix of disposables and implants that are able to put all their eIFUs on the same site. As the CARAD site has added a patient portal to go along with its HCP portal, and you're able to put your patient information there as well. Oberon Technologies, Zoom, Mimeo, and DocSpot are other suppliers in this space. The CARAD site just hosts e-labeling and can be configured to make it look like the end user is visiting your site. You're looking at a sample of the CARAD site mocked up to look like it's a network partner site. This isn't intended to be a commercial for CARAD. I just wanted to show you what an eIFU hosting site looks like. We've had the opportunity to see a couple of company sites created specifically for eIFUs, not normal corporate websites, and they're very, very similar. This makes sense because all these sites have been built to meet the exact same requirements. You can point the healthcare provider to your website either with a symbol on the label or with a pointer card or a patient implant card in your package. The website can have your company's name on it. Most companies include eIFU or eIFU website name. This website that looks like your company's website directs to a partitioned CARAD website where your and only your eIFUs are hosted. When the HCP goes to the website, they see your splash page. I'm not a web page designer. I'm just told that's what this page is called. You can configure this page to pop up in a language of the country where the HCP is accessing it from, or you may also have a language or region dropdown depending on site configuration. You have a lot of options with their out-of-the-box offering, or you can go all in and customize the option. This obviously costs more, but it is available if you need a level of sophistication that goes beyond the basics. This page can be corporatized with your company name, like you're seeing here, logos, colors, text, or text fields. That's just the wallpaper to the working part of the page in the middle. The graphics in this box are also customizable. Most companies show the user where the catalog number, G10, or other key code can be found on the labeling. The user is instructed to enter an identifier, catalog number, G10. Then the user selects the desired document and language. Then the site makes sure you're not a robot, so you can download something. The regulations require that all previously electronically published versions of the IFU be kept on the website. The user is asked to confirm that they're downloading the correct version of the IFU. The last approved version of the IFU is the IFU that is presented to the user, and the user can download the IFU by clicking the box. CARAD also has a patient information portal that the patient who gets an implant can visit in a very similar manner. The eIFUs and the patient information you load to the site should be controlled by procedure. We are seeing companies having interesting internal discussions as to what to make available in this manner. As far as we know, all those companies have made sure that these sites are being used strictly for regulatory compliance. No marketing. This is what the user sees. The backside of this website is where you load and maintain your eIFU PDFs, your documents, and product metadata, and where you link the associated SKUs and documents. Here's where you would upload your eIFUs and document metadata. You might want to consider a file naming convention that works for both your doc control as well as your eIFU website. You would also associate the revision number and publish date, approval date of the eIFU in this metadata. Here's where you would load your product metadata. That data would include the other identifiers associated with the catalog number, the G10, the product description, a key code, something that you want to include to help users find their eIFUs. The SKU linking then finishes the process. You can link these SKUs to an eIFU or multiple eIFUs. You can link the SKU to a country language specific file, or you can configure the system to display a particular language based on the user's location or their language preference. You can even let a user from Lithuania know that the eIFU they are looking for is not available in their language because the SKUs associated with that eIFU are not registered for sale in Lithuania. After we load the eIFUs and link the SKUs, we will sample a number of random catalog numbers, G10s, in random languages to confirm that the site is operating as expected. We'll collate all the data that we've loaded, the linking spreadsheets, and the objective evidence of our confirmation test, and attach it to the change order for final approval and closure. The uploaded data and documents can also be exported from the site log as evidence of the change order. And if you understood any of that, you're like a winner. CARAD has a user's manual that steps through the process for actually doing all of this. With the website loaded up with linked eIFUs and associated documents, we can finally revise the labeling to point to the eIFU site. You'll kick off this project with a change order. You'll revise the labels by putting the website address under the See Instructions for You symbol. And if you don't have a global labeling, enterprise labeling system or end-to-end labeling system, and you don't have time to change your labels, you can always add a pointer card to the inside of your package. Also, if you qualify for 207-2012, once the labels are revised, you can create a new change order to remove the pre-printed IFU or the vast majority of pre-printed languages on the IFU. Additionally, you may revise the procedure for uploading of eIFUs and patient information to more closely represent the change from creating the database to the maintenance of the system. Anecdotally, since we have a moment, I was speaking with a leader in our industry, and she told me something very forward-looking. This woman is amazing. She said that this loading IFUs and patient information should be a defined policy in your organization, because as you merge and acquire other companies in the future, it'll be imperative to have a clear path to not only integrating their eIFUs with your program, but how to maintain their existing IFUs until they're no longer needed. Really something to consider. One further note. MedTech in Europe, the industry advocate to the European Commission, is pushing for an opening up of the ability of all medical devices sold to healthcare professionals to be eligible for 207-2012. If you use a lot of pre-printed IFUs or your IFUs are really expensive, you should set up your eIFUs so that you're ready to pivot quickly to taking the pre-printed IFUs out of your packaging. My experience a few years ago was that by just removing 12 languages from our 22 language pre-printed IFUs, we saved $6 million a year and took 175 tons of paper per year out of the waste stream. It's not often that RA and labeling have an opportunity to lead a cost reduction. So make sure you keep your eyes open for this potential. That concludes the presentation. That was a lot of information for those of you on the very front of the process, and I hope for those of you in the middle or near the end of the process, you were able to learn something of value from this webinar. I've told you everything I know, but I have a couple of very knowledgeable associates with me that should be able to answer any questions you may have at this point. Okay, and I'm just now looking at the comment section. What do we have here? And okay, now the illusion is blown. I'm not doing this all by myself. What's the best practice for website structure for eIFUs? Is one URL for each IFU overkill? Alternately, is it better to put all IFUs on one web page, possibly with other supporting documentation, such as surgical technique guides? And the answer to that is it's always dependent on your circumstances. But what we are seeing, the best way to do it is to have a single URL that takes you to a website that goes through this, that goes through what the CareAd site does, which you're able to store all of your eIFUs on one site, link them to your SKUs, separate all the languages if that's the way you're going to do it, and have a single URL with everything on that one site. If you only have a couple of IFUs, you could have a different URL for each one, but I think that would be overkill. Okay. Another question is, how does the customer know to look for an eIFU? Oh, I know this one. On your label, the ISO 15223 is being revised. They've been using this icon has been out there for so long that they're just adopting it. It's your See Instructions for Use symbol, the little iBook with a web page underneath. That's how the customer knows to look. And if you don't have that on your label, this is where you can put it on your patient implant card or use a pointer card in your packaging. Another question. How does eIFU work for global manufacturers, as some countries require you to declare unapproved for supply if a product is not registered, and in some countries it will be considered as false advertising of unapproved products? You can set up a disclaimer in your eIFU website that addresses that for that country. Where I mentioned if a Lithuanian is looking for a particular SKU or eIFU, you can put a disclaimer in there that this product that they're looking for is not sold in their country, and we've seen that. We've seen one client do that. And again, I have to stress, we don't know what an EU MDR audit result looks like yet. There just haven't been enough of them to have a lot of historical data to base these opinions on. But I would imagine that if you told a region in their language that the product wasn't allowed for sale in their area on this website, that would be good enough, even though they'd have access to it. Is the product CareAd? Oh, thank you very much. And that was answered by another person, QARAD. Thank you. Is it mandatory to reformat the IFU to use this service? Could we use the existing multilingual IFU and make it available to all markets? Great question. You certainly can. You can simply post that IFU, post that PDF, and then point every SKU at it in every language for every region. Another question. What are the best strategies for past revisions? That's a great question because we get this a lot. You have a product that's been on the market for 20 years. You're just now going to an e-labeling or an eIFU. You don't need to worry about, you don't need to post the past revisions. You just need to post the current revision. The only past revisions that'll be on that website are revisions that you've already posted electronically. If you go back and read the that's in 207-2012. I believe that's G. Is that right? Yeah. Is it mandatory? What are the best strategies for past revisions? Sorry, I just answered that. I just read that question twice. That looks like all of our questions. If anyone else has anything, feel free. We're at 12:30. I'd like to thank everyone for joining us here today. It's a beautiful day here in northern Indiana. I hope you're all well. Look for an email from Network Partners containing the webinar, the PowerPoint presentation, and the eIFU white paper. Obviously, if you'd like to, one more question, is it common to search the eIFU by G10s, or does the model number just work? That's a good question. You can set it up however you'd like. All these, you can set it up by catalog number, you can set it up by G10, or if you want, you could set it up by key code. Some people are concerned when they set it up by key code. For instance, if you're a catheter company and you type in the word catheter, you may get 50 eIFUs come back in response to that. So it's a balance there. But you can use however you want, as long as you explain to them on that front page, on your splash page, where they can find the information to find the eIFU. So anyway, you'll receive those three things from us. I hope you're well. I hope we can get back to working normal again. Thank you very much. Bye, everybody.